After more than a year of trying to contain a raging virus, came this announcement.
I do not expect COVID-19 to disappear. It will remain with humankind and become endemic.
Becoming endemic means acknowledging that the virus will not disappear. Instead, it will continue to circulate within the community, with people learning to live with the virus. In this new normal, COVID-19 restrictions are gradually lifted. But in September, amid an exponential rise in the COVID-19 cases, group sizes are down to 2. Work from home again the default. Seniors discouraged from going out. And for 2 weeks, students are back on home-based learning. The multiple testing regimes. And the constant reporting of numbers. Critics have said this goes against what living with the virus means. In this episode, I find out what it truly means to be endemic and what it's going to take for us to get there. I'm starting my investigation here at this hawker centre. Joining me is infectious diseases expert Dr. Ooi Eng Yong. So the strategies we're now taking as we move towards an endemic state, have we got it wrong?
I think it's being overly conservative. What Singapore is doing now is based on what they did last year, which made sense because there was no vaccine. So the only way to prevent this massive impact COVID-19 could have on our population was to stop transmission as much as it could. So now with COVID-19 vaccines, technically there's nothing for us to fear.
Because our vaccination rates are so high, you're saying we should really just put our trust in that and let the virus take its course.
The reality is there's no other choice. If we really want to control Delta, with these physical measures, we probably have to be a lot more drastic than we are right now. But that's going to take a toll on the country. So those are prices that we will have to pay if we really want to have this zero COVID. But the reality is that how long can we sustain this zero COVID? Because this COVID is here to stay.
So in a way, you're also saying that the measures we're trying to take now is because we're aiming to have zero COVID within the country.
It's a legacy of zero COVID. I think on the one hand, everyone understands that there's no such thing as zero COVID. That conceptually people get it, but to kind of practically now say, I'm going to let go because this is not feasible, that's a hard thing to do. It's like if a certain formula has led you to success, then you keep wanting to repeat that formula.
Correct.
You're not going to try something new. And I suspect we're caught in that kind of cycle right now.
A zero COVID-19 strategy. That's when countries aim to completely eliminate the virus via drastic measures like strict lockdowns and quarantines, extensive testing, and closed borders. So we're doing a lot of mass testing, a lot of tracing. Is this actually counterintuitive towards our move towards an endemic state?
We shouldn't have to do all that in an endemic state, right? Because you're not going to try and determine how many people got infected.
So in a way, the old method of looking for the virus, capturing it, isolating it from spreading is not going to be effective anymore.
Yeah. The virus is everywhere. And we got to stop counting PCR positivities because that's not how vaccines work. They're not designed to prevent us from testing PCR positive. They're there for use for us to prevent ourselves from getting severe COVID. And maybe we need to qualify into, say, flu-like COVID, COVID with warning signs, and severe COVID. So I think that might actually help the public to accept that, okay, I have flu-like COVID, it's no big deal.
Singapore is not the only country that has shifted its approach from zero to endemic COVID-19. One country started even earlier in May, Germany. And I'm heading to Munich to catch a glimpse of what it takes to live with COVID-19.
Munich time is right now 6:33 in the morning. Cabin crew, please prepare for arrival.
It was a breeze going through customs. Most importantly, no quarantine required. Germany's border is completely open to those who are fully vaccinated. Within Europe, leisure travel has resumed too. And I'm catching up with a Singaporean friend and her family. They've been residents in Munich for a few years now. Like me, they've been itching to go on a long-awaited vacation, so they took their first trip abroad in August, right in the middle of the pandemic.
Travel restrictions have been lifted since some months ago, and we went to Switzerland.
Those based in Germany are allowed to travel freely to bordering countries like Switzerland, France, Austria, Belgium and the Netherlands. No quarantine needed.
Generally, in Germany, all this while outdoors, we do not have to wear masks.
Life has changed a lot as compared to last year.
So guys, do you have to wear a mask in school?
Yeah, but not when we're sitting on the desk, then we can take them off masks.
Even if you're sitting so close to each other in school?
Yeah.
You're going to open clubs in October too.
Okay.
And as for social gatherings, since May, there has been no more limits to how big your group gets.
You're not worried that, being this relaxed in a way that it may then allow the virus to come back and have more cases?
I think we have to learn to live with the virus somehow. And if you compare to last year, there was a lot of uncertainty, a lot of fear. But I think the last 12, 15 months, I think everybody has become a bit more relaxed.
A large part of where this confidence is coming from is also because of how Munich is tracking COVID-19 cases. Instead of reporting daily cases, they use a hospital signal light system. It's just like, well, your traffic light. When conditions are good, it'll be green. Level yellow is when there are over 1,200 COVID-19 patients in hospitals within each of the last 7 days. And level red is when there are over 600 COVID-19 patients in the intensive care units. During the time of filming, Munich is still rated green, even though daily cases are on the rise.
So you actually feel safe?
Yes, absolutely.
Yeah,
Absolutely.
yeah.
I mean, we are all tested, we are vaccinated.
Yeah, but having said that, the kids, they are not vaccinated yet, so we still need to take the extra precaution to protect them. We test like maybe every 3 days if we have social gatherings.
This is kind of a social responsibility.
Laura and her family can conduct self-testing so frequently because home kits are not just easily accessible in supermarkets and pharmacies, they're also very affordable, at just $1.50 Singapore dollars each. That's over 6 times cheaper compared to our antigen rapid test or ART kits back home. I'll soon discover that all these strategies are allowing the state of Bavaria, where Munich is the capital, to open up on a large scale. I'm in Munich, the capital of Bavaria. If you think you're seeing pre-pandemic scenes, think again. This is filmed in September this year. Here, since May, restrictions are relaxed for people like me who are double jabbed. And you'd be surprised, this happened just after Germany's third wave in April, when there were over 14,000 deaths and over 1 million new infections. One of the reasons Germany lifted restrictions so quickly is home recovery. Home recovery has been the default for those who are tested COVID-19 positive in Bavaria since last March. Only those with severe symptoms are sent to the hospital. The Federal Disease Control and Prevention Agency had put together a set of specific instructions for those in the home recovery. From how towels should be used, how frequently touched surfaces should be disinfected, and even the temperature to wash your clothes in. Clear guidelines coupled with a strong sense of social commitment. These are crucial in a state's move towards the new normal.
Yes, I'm not wearing a mask, and that's not just because I'm filming. Actually, it's legal for us to be unmasked when we're outdoors here in Munich, Germany.
It's a refreshing sight, or should I say, breath. But there are a few places where you would have to put your mask back on before you are allowed to enter. Indoors and on public transportation. Munich implemented this mask policy in June, while countries like Singapore still insist on mask wearing outdoors. Why such a bold move?
So what was behind the decision to allow people to go without a mask?
infection cases drop. The second point is that due to the vaccination, you hardly see any very severe cases that have to be treated on intensive care.
Okay, so in a way, you weren't too worried about the risks involved.
Exactly. And especially outside, the risk of transmission is much lower when you keep 1.5 meters distance as we do now.
So I brought these masks here to ask you about them. I know this one is not allowed. It's a cloth mask.
Right. I mean, the cloth mask doesn't fulfill any standard, and therefore it's not a defined protection.
What about these two, the surgical, and this one's an N95, or I think you guys use a FFP2.
Yes. It looks like an FFP2.
FFP2 masks are similar to our N95 or KN95 masks. Only such masks and surgical masks are allowed.
It's designed such that it fits better to the face,
right,
and there is less leakage, so it protects better the environment, but also the person who wears it than this one.
Why make the switch? Why move from this to that?
Because this is more comfortable, cheaper and easier to wear, surgical masks, and it provides good protection especially against droplets, larger droplets.
And do you think there'll be a day when we won't need to wear masks at all?
Theoretically, yes, provided the virus goes down a lot or behaves like a seasonal coronavirus, or a very high vaccination frequency, more than 70 or 75% of people vaccinated.
Munich has a vaccination rate of close to 65%. And while they have eased up on mask-wearing rules, they are stricter about the types of masks allowed. COVID-19 numbers were on the rise during my time here. Yet I'm about to attend my first large-scale event in 2 years. Munich is going ahead with the country's first major trade show since the pandemic, the International Motor Show. It's a week-long event, attracting a total of 400,000 participants from 95 countries. But instead of a single event site, a quarter of the show is held across 7 open spaces in the heart of Munich City. So what does it take to organize an event like this in the midst of a pandemic? I'm meeting the man in charge. Clement Baumgartner is showing me one of the open spaces in the historical market square, Odeonsplatz.
The IAA has one main precaution, and that's wearing a mask.
Because this is a large-scale event of over 1,000 people, mask wearing, even outdoors, is mandatory, and strict checks are enforced.
Even outdoors, because our fear is that people come together too close, so you can control them. These spaces are marked with a fence, so you can enter only at special designated lanes.
Okay.
These lanes, you check the measurements, the COVID vaccination, or the healing certificates, or the test certificates.
Is this what the future of big shows, trade shows like this is going to be like?
It's the best mixture between safety, which we hold up high, but letting a fair happen. And so far until now, we don't see any fundamental increase in the numbers which we hadn't seen before.
For this trade event, it's open to anyone from anywhere in the world. Aren't you concerned about imported cases of the virus?
There are countries with huge infection numbers, with a huge incidence, and they are not allowed to enter Germany without quarantine, without a PCR test. We closely make a difference between different countries.
Germany's border restrictions is based on the European Union's recommendation of safe countries. The list is periodically reviewed to take into account changing COVID-19 situations. Countries not on the list are subjected to quarantine, testing, and entry registration. The country's border control serves as the first line of defense against the virus entering Munich. The second takes place at the entrance of the event sites, including the one at the main exhibition center. Those entering would have to follow the 3G rules: to be vaccinated, tested negative, or recently recovered from the virus.
And I'm in. It was pretty easy, just needed to scan my ticket, which I had registered online, and upon arrival they just asked me to show my vaccine cert, and they let me through.
After the checks at the entrance, I'm free to roam around any of the 9 halls. Initially, I couldn't help but feel nervous about being confined in an enclosed space with so many people. But in no time, I'm enjoying myself.
It's really exciting to kind of be back at an event like that with a huge crowd.
As Munich continues to open up, one group remains vulnerable. Children below 12 years old, because there is still no approved vaccine for them.
Als erstes nehmt ihr den Abstrichtupfer aus der Verpackung.
So how is Munich keeping school life as normal as possible? I'm traveling to the rural outskirts, 15 kilometers south of Munich.
I want to find out what schools are doing to welcome their students back in a way that will keep them safe in this new normal.
This is Gymnasium Grunwald. On a normal school day, this place would be teeming with over 800 students between the ages of 8 and 18. But today is the last week of the 6-week summer holidays. Principal Birgit Koda has been hard at work preparing for the students' return.
This is a just normal classroom. In every classroom, we've got a kind of stageness air purifier. So you see it up there and up there.
Make sure the air is being cleaned.
Exactly.
I guess.
This system, it's a CO2 signal, which shows how kind of clean the air in the classroom is, especially in winter when the doors are closed. So we've got the signal green, yellow to red. When it's yellow, students tell the teacher, oh, it's getting yellow, so open the door and get fresh air in. And then we've got regular self-testing 3 times a week, Monday, Wednesday, Friday.
Will all students have to take this test?
Well, the ones who are not vaccinated have to do the self-testing. The others who are vaccinated don't have to do the self-testing. If one student is tested positive, he has to go in quarantine. The ones in class sitting next to him who is vaccinated can stay in class and don't have to go in quarantine too. This is perfect because we try to keep students into face-to-face lessons.
I see. So if my friend gets it and I'm vaccinated, I can still keep coming to school.
Exactly.
But if I'm not vaccinated, then I would have to stay at home.
Exactly, for 5 days.
Self-testing is a nationwide initiative. Kids as young as 6 have to test themselves in school, and that's where this video comes in handy.
Als erstes nehmt ihr den Abstrichtupfer aus der Verpackung. Dafür zieht ihr vorsichtig.
Because only the unvaccinated close contacts need to be quarantined, school is less disruptive.
Could you close the school down if you felt there were too many cases here?
I have to kind of get in contact with the health department, and they will send single students or a single class in quarantine. But the minister said it's their aim for this school year not to close a complete school again.
June 11th spells the end of remote learning for students in Munich. This comes after 2 statewide school closures, a total of 3 months since the pandemic started. In a further move to becoming endemic, Germany expanded its vaccination drive. Since the start of September, close to 800,000 booster jabs have been administered to these specific groups of people: elderly in care and nursing homes, those with weakened immune systems, and those who received the AstraZeneca or Johnson & Johnson vaccines.
So why is there a need for a 3rd jab now?
Despite a global debate around the need for boosters, with the World Health Organization stating that there is no conclusive evidence that it is needed, virologist Professor Ulrich Protzer still thinks it's a step in the right direction.
So globally there's been debate to get booster shots. Why is there a rush for it now?
There is now the first studies who show that after 6 or at least after 8 months, we see people tend to become ill again. have to go to the hospitals again.
Do we know how long this booster shot will protect them for?
We have to admit we just don't. What we know from other vaccines is that you very often have to give 3 shots. Yep. And after a 3rd shot, you have a certain time, like 5 years or sometimes even 10 years, where you don't have to give anything.
And how effective are these booster shots against the changing variants?
If they now test for the efficacy against the Delta variant, then you see a drop. That means if the Pfizer-BioNTech one was like 95 efficacious, it now goes down to 88%. It's still very good for a vaccine, but it goes down.
Right.
So another option, and I think a very important one, would be to adapt the vaccines to those Delta variants and then use those for a booster shot.
Right. So in other words, let the vaccine further improve and evolve to, I guess, cover more strains and then use that as a booster shot.
Yes.
So how would this 3rd booster shot help countries to move towards an endemic state?
What we do is with these 3 shots, we increase the ability of our immune system to really rapidly react once it's exposed to the virus, and hopefully doesn't let the virus into our body at all.
And obviously the less of it in our body, then the less chances of us getting severely ill. Now, I haven't traveled in over a year, so it's great to be here and to see what life could be like living with COVID as an endemic state. And Germany has actually moved forward in many of those aspects. They are no longer counting the number of daily cases. Their borders are open.
More importantly, people take it upon themselves to be socially responsible. And instead of fearing the virus, they have decided to live with it.
And looking around at the crowds and the people milling about, life seems almost normal. And you know what? I'm really looking forward to the day when Singapore gets there.